Indeed, we have begun. So, effectively, I'm going to do this in two sections, the autonomic nervous system. The plan of attack for Monday is basically to have review sessions, sort of to augment the review materials that I sent to you before. And again, they consider them optional. I got to be here on Monday anyway. I have students in taking some of my advanced students are taking their final, a little early in their final period. So I'm going to be here in any event. So come in and listen to it some additional review times. That's fine with me. All that stuff. Again, it's up to you. As you can see, there's a certain degree of optionality here. That's a word, so I'm not so sure it is. About attendance. Remember the first day when we had like 35 people, you couldn't barely get a seat? Normally I would be bothered by that, but curiously I'm not. Thank you. Phone. Moving on. So we're dealing with the autonomic nervous system. This is going to be the construct. Probably we'll deal with the neurotransmitters and a little bit more in earnest on Friday. So, autonomic nervous system. Because basically, I did the introduction. I just want to review it because inevitably I do things hurriedly toward the end. It's by definition involuntary. It's all of these things. It's homeostasis. Things you don't have to worry about effectively when your blood pressure has to be adjusted or your heart rate has to be adjusted or whether I should be focusing on digestion or not. All of those types of things. So it's all subconscious in nature. And again, divided into two divisions. The action division is sympathetic. We call it the rest and digest because that's basically what you're doing when you're at rest or even sitting here, is parasympathetic. Very rarely, other than what I described to you previously as fight or flight, this emergency situation, okay, which you have to be cognizant of. Other than that, there's always a little bit of activity of both. Only in fight or flight do we really see the closest thing to pure sympathetic activity. Other than that, they're playing somewhat of a biological tug of war to try to keep things in balance that are there. And they work this way through a variety. I'm not going to deal a lot with this structure and talk about efferent pathways and ganglia and blah, blah, blah. We'll talk a lot about the neurotransmitters and what they do at various areas. And there's a lot of definitional stuff that goes on. And so what does it innervate? Smooth muscle, all those wonderful hollow tubes, glands, the vast majority of glands, the heart, lungs, etc. Things that we don't even think about. And the illustration is much better than when I presented to you previously, okay? And so you're going to see illustrations of what is preganglionic and postganglionic. You don't have to draw them. You don't have to recognize them. I never do label the diagram stuff. To understand that it's a two nerve circuit. And basically the connection between these nerves is what we call a ganglion. And by definition, that's a collection of cell bodies that lay outside of the central nervous system. Do you see them? And where they lay is somewhat significant because it's really an anatomical characteristic. What you're going to see is that the vagus nerve is a very long nerve. So typically that's the so-called preganglionic nerve. It travels all over the body. And where it eventually meets that ganglion is very close to where its target is. So we call those long preganglionics, and I'll reinforce this point, and short postganglionics. The opposite, the sympathetic you're going to see is right next to, but not in, immediately outside of the spinal cord. Right next to all those vertebrae you learned about that stack up together. So they have very, very short preganglionic fibers, but long postganglionic fibers. That's an anatomical distinction. I'll probably ask a question about that. That's the kind of thing you have to put into your memory bank. Particularly, but again, I don't know what licensure exams. I have a pretty good idea what licensure exams are like, but those are the kinds of things that if I don't emphasize them, but somebody will because it's a significant anatomical construct. Moving on from here. So these are all about acetylcholine in the autonomic nervous system. All's a good word. You don't get a lot of that in the human body. Preganglionic fibers release acetylcholine. So acetylcholine, the one we know the most about, is a major player. The postganglionic fibers release one of two things: norepinephrine, again known formally as noradrenaline, and acetylcholine, at whatever their targets, their effectors are. And basically, that's about the receptor. It's either stimulatory or inhibitory. Again, memorize exceptions. You're going to see there's only a couple of exceptions to these that we will come to over the course of today and Friday. And again, I'll be here to reinforce that again on Wednesday. I beg your pardon, on Monday. And thankfully, we're soon to be done after. So many sporting events to watch, so little time. So, the higher brain centers, yeah, they play a role. Most spinal and many cranial nerves have both of these fibers. That's probably a misstatement. Okay, many cranial nerves. There's only 4 cranial nerves that have involved with this. The sympathetics. Use this one. The sympathetic nerves are all associated with. All of them start in what we call the thoracic and lumbar area. So they basically go from T1 to L2. See, when you learn cranial nerves, I understand the limitations of doing that rather hurriedly. Yeah. Parasympathetic nervous system is called cranial. Terrible mark. How dare they give me parasympathetic is known as cranial sacral. It involves the sacral nerves, which are self-explanatory. That's 5. And the cranial are strictly 3, 7, 9, and surely the most important of all. So here, sympathetic T1 to L2. Better. Voila. So, usually, they're active muscles require more oxygen and glucose to autonomic nervous system. Nerves speed up heart rate and open airways. Okay, that's when we're going to get to fight or flight. Effectively, when you are active, that's what we call the active or the action division is a sympathetic. And effectively, the major thing that it does is it basically just redistributes blood flow to the areas that are involved. It redistributes them to the heart, in the meantime increasing heart rate, in the meantime increasing respiration, because the more your heart's pumping, the more oxygen you need, the more oxygen you have to bring in, and it redirects the blood flow to where it's needed, skeletal muscles, and effectively away from your digestive system and your genitourinary system. At rest now, a tremendous amount of your blood flow, probably somewhere between a quarter and a third of all of your blood flow, is going to those 2 areas. This is when we do this stuff. This is the science behind why it's happening. We all know that. When you get up in the morning, you got to go to the bathroom. That's because those systems have been busy overnight, concentrating the urine, allowing your digestive system to process stuff. Yeah, it's just the way it works. So this is trying to impart an understanding of why things happen in the body at different times. And by distinction, why you're in the middle, if you're an athlete and you're in the middle of an important match or an important game, it's not so easy to have to run. Part of me, I've got to get off the field and go to the bathroom. It doesn't happen. Or fight and flight, running away. Some bad guy's chasing you. You can't stop. Wait a minute. Potty break. I think you're not good. Think of it. I try to make silly examples because I think silly things are easier to remember in general. Do you know what that doofus said in class today? That should help you remember it. It's been a long day already. The dog had whatever he ate last night at 5 o'clock in the morning was, I want out now. right now, and nothing else will do in the effing freezing cold. Did he say thanks, Dad, for getting up? No. What? So voila, typical nerve going to one of your muscles. Highly myelinated, releases acetylcholine. It's always stimulatory. Fine. Sympathetic. Don't worry about the shorts and longs for the time being. Effectively, it goes to its target. This is the oddball, so we're going to get to that in a second. This is the major sympathetic nerves that all of a sudden in fight or flight is going to redirect blood flow to the heart, and to skeletal muscles. They release acetylcholine and they go to their targets. Don't worry about the myelination. They release acetylcholine and then they release norepinephrine. So the preganglionics, all acetylcholine, the postganglionic, norepinephrine. Here's the oddball. This is a gland. In AP2, you're going to go to the endocrine system. In the endocrine system, the glands that sit, that you've all heard about, called the adrenal glands, hence the name adrenaline in the old days, sit adjacent to the kidneys. That's what adrenal means. Okay? So they're next door to the kidneys. In this case, they're on top. And they're tiny. They have an outer area called the adrenal cortex. That makes corticosteroids. That's why we call them corticosteroids. Steroids because they're made from cholesterol, cortico because they come from the adrenal cortex. That's a true endocrine gland. So I'm giving you the lesson already on endocrine that I'm not going to be giving you in AP2. It goes all that, the stuff it gives off, all the cortisone and something called aldosterone and different kinds of agents, androgens that you heard about, anabolic steroids. They all come and they kind of are surrounded by a big wad of blood vessels. Inside is the adrenal medulla. And that's the one that releases directly into the bloodstream. So it's unique. It's actually, we think it's a misplaced ganglion. All the ganglia you're going to see are very, very close to the spinal cord in the sympathetic nervous system, except one, and that one is here. That is this ganglion that's really in the middle of the adrenal medulla, and it releases a combination of epinephrine and norepinephrine. Aren't they the same thing? Not exactly, because they target different things, and you'll learn a bit about that as time goes on. Yeah, and it's not really a dramatic point, so to speak, in this particular course. That's why when you have fight or flight, and go back to the idiot who cut you off, it takes you a little while to calm down, whether it's a couple of minutes, maybe it's 5 minutes, depending on how near-death experience and how severe the experience was. Okay? The prolonged activity comes from an outpouring of these two chemicals into the bloodstream because they prolong the effects. Your nervous system is quick. Your endocrine system is slower, by no means slow. So this could be not fractions of a second, but seconds, minutes, hours, days. Okay? That's the idea. That's the unique part about this area. And this is where epinephrine and norepinephrine, and we'll get to why the EpiPen is so useful down the road. Lastly, the parasympathetics are pretty straightforward. They have long preganglionics, they release acetylcholine, and they also release, good thing for us, acetylcholine as well. So it's very, very interesting. Okay, and you're going to see a couple of limited exceptions that we'll talk about. In general, even though the effects are mostly positive, they can be both positive or negative. It depends on the kind of receptor. But if you want to broad brush it, and in this case we do, acetylcholine is released at the preganglionics. Acetylcholine is released here. Okay, at the neuromuscular junction, we already knew about that. Acetylcholine's in the brain. We just learned about that not too long ago in a previous chapter. And you'll see even acetylcholine is associated with the postganglionic nerves in the parasympathetic nervous system. Got it? There's definitely a test question on all that stuff. So, parasympathetic maintenance functions, conserving energy, Sympathetic mobilizes during activity. I mean, the minute you start to leave here and all of a sudden you're going out into the cold and going wherever you're going, unless you happen to be staying in this building, the minute you start action, the sympathetic nervous system begins to engage. It doesn't get full blown unless you're racing someplace. I got to race back to my dorm because I forgot something. All, and that's a bad term because I think it's incorrect. Okay, the vast majority of visceral organs, and I'll give you the exception as we move on, are served by both divisions, but these divisions typically cause opposite effects. And it's my favorite word in this whole chapter: dynamic antagonism. They are antagonizing, working the opposite one another, but it works. It's like you and I pulling in opposite directions, but if we're doing that, holding something and both are moving forward, we're going to move this object. I may be pulling it this way, you may be pulling it that way, but if our feet are moving toward the door, it's going to move toward the door. And that's kind of the beauty of dynamic antagonism. It works. Okay, it governs us. We do this in our thoughts. You know, how do you make a decision to say something? I have a bad habit that I've gotten a little better with as I've gotten older. No comments. Okay, because very often when you're younger, and mine was really guilty of this, my mouth worked before my brain was fully engaged. You know people like that. Now the filter kind of kicks in and goes, don't say that if you want to keep your job, because I'll say something I shouldn't say. Like, maybe not. I've gotten better. I've only been fired a couple of times. Never tell the higher ups what you really think of them until you get home. Save it. I go into the car. Go, that. Save that. So I'm fine. Don't get mad. Get even. Parasympathetic promotes maintenance functions and conserves energy. Sympathetic mobilizes. Dual innervation, dynamic antagonism. Parasympathetic, body energy use as low as possible, even while carrying out maintenance activities. Digestion, urinating, defecating, etc. Okay, rest and digest. What you're doing now, hopefully, because you're certainly not inspired by my feeble attempts at humor. I'm busy. Oh, it's okay. My oldest grandchild is 24 today. Help. Not a whole lot of 24-year-olds in here, are there? That aged me. So, blood pressure, heart rate, respiratory rates are comparatively low. GI and genitourinary activity is higher. That explains why me, being the more active of all of us here, typically can be here, and why periodically some of you have to go to the restroom. I understand that. It's okay. No penalty for doing that. Okay? What you're going to see, and this is building up to why 3, 7, 9, and 10 cranial nerves are so important. Pupils are constricted, lenses accommodated for close vision. Typically, when you're doing that, maybe you're doing what a lot of you are doing. You have your iPads open, your computers open, and you're making notes. That's close work stuff. Some of you are just looking at your phone for whatever reason. That's fine. I don't care. I look at mine all the time, too. Okay. Third cranial nerve is which one? Learn this. It goes like this. You have to know the names and the numbers. 3 O's starters. Olfactory, optic, oculomotor. It's the one that has all those little muscles in your eye that you test like that thing, right? It's the first one that has parasympathetic activity here. What it does is that is attached to something called the ciliary ganglia in your eye. So what does your eye do? We do this test all the time. You're going to be in a clinical field. You're going to be in a nursing evaluation. You're going to have a little pen light. You're going to take that pen light and bring it along on this side. And when the light starts to reach this eye, what's it going to do? It's going to constrict. Just want a whole lot of light. It's like when I turn the lights on and off. Okay, and it's going to do it on both sides. Okay, so as it comes here, not just this eye is going to constrict, both eyes are going to constrict equally and at the same rate. We look for symmetry. When you do a concussion test, you look for asymmetry. Concussions are usually one-sided. So that way, if this side goes normally, and you learn what normal looks like, and this one's kind of sluggish, it's whoa. So you do it on this side, and you do it on that side. They should look the same. Okay? When you pull the light away, okay, they'll pull the light away, they'll begin to dilate. When you're looking up here, that's what 20/20. You're basically, if you're looking from back there and looking at the board, your eyes have to open wide. What happens, along with controlling the diameter of the pupil, it also flattens the lens. When your lens is like this, convex on both sides, it directs the beam of light to where you need to see it. As you get farther away, the lens has to flatten. It has to do with the arrangement of the eye. You're going to learn about that in two eyes. Okay? We call it the pupillary light reflex. The other thing you test is take, now if you take, look at the tip of this pen, close to them, the pupils follow it, and the pupils constrict. So your eyes move more to the midline. That's called accommodation. And the acronym we use is called PERLA. Now, this is not good. Pupils are equally reactive to light and accommodation. One of the things you write on a chart when you're doing a physical exam. Third cranial nerve. That's parasympathetic in nature. Why is that important? Unfortunately, what we see a lot of in this world are people who have either by accident and unfortunately many times by intent taking the wrong thing. So if someone, how do we know if we should give somebody dark hair? Okay. I mean, sometimes if you got it, you probably should give it to them. Whether you don't know what they've taken, but but basically, if they've taken a narcotic of some type, if they have a heroin overdose, fentanyl overdose, whatever, you should give it to them. But the way what happens is their pupils are constricted. When the pupils are dilated, that is generally an overdose of speed or cocaine. One is an excitatory agent. It fires your sympathetic nervous system. And in the sympathetic nervous system, your eyes are wide open because you have to see fight or flight. I got to see who's chasing me. What I have to do, where's the car? That's that nervous system. So that's a little clinical nugget that you already know. When somebody comes into the ER and they're comatose, you can't, what did you take? So you open their eyes and you want to take a look if their pupils are pinpoint wide open. Start thinking about excited cocaine or speed or excitatory substance. If you don't know, then you probably should default to the one that you can at least have an avenue to treat. If the pupils are blown completely, they're in good trouble. When you have pupils are blown, then there's no response whatsoever. They're wide open. They're probably not going to make it. Okay. 7 and 9 nerves are easy. Salivary glands. 10, the most important of them all is the vagus. That's the one that basically goes through all the organs. 3, 7, 9, and 10. If you don't remember, 7 is facial. That has basically salivary glands here. Salivary, sublingual, and submandibular, and you'll get this indigestion. And 9 is here, your big salivary gland, carotid. So what we do for surgery, because secretions are bad, because you can't intubate somebody, is you give them an agent that you will see called atropine. They used to, there's probably something new today that works more efficiently. And what that does is it dries up their secretions. That's part of a preoperative cocktail. Nowadays, the anesthesia people do it. And if you're a nurse anesthetist, you go around and make rounds and you write those orders. See, this is clinical stuff. So unless things have changed in the last 25 years, and they might have, and they have a lot of them. I don't, for everybody, understand what I'm telling you is for context. Wherever you're going for additional training, whether it's here or anywhere else, or after you graduate from here, it's going to be a whole lot more up to date than I am. So most of the information I have to use, some things don't change, but the medications change, the technology is light years different. I'm always fascinated when I end up when I'm for whatever reason in the hospital, preferably with somebody else rather than me. Unfortunately, most of the time it was me. So going back, so we got all that, pupils constricted, etc., etc. Moving on, we have the sympathetic division: fight or flight, exercise, excitement, emergencies, embarrassment. Okay, increases your heart rate, drying the mouth, dries up those secretions. It's the opposite. That's parasympathetic. So the sympathetic nerve fires your heart. And what it does because of that, and it's unique, is it dilates the bronchioles. When you get to respiratory, the bronchi are the large tubes starting with it. They basically start at the end of the trachea. The two tubes that go into your lung. They continue to branch. When they get so small that you can't see them, we call them bronchioles. Just the way we use a diminutive suffix for arterioles, for venials. All of that is AP2 type of stuff. What's interesting about that, those are the ones that are involved when someone has asthma or anaphylactic shock. The tubes are so small, the muscle around them can squeeze and block air from going in. So when someone can't breathe because of asthma or anaphylactic shock, you can't intubate them. The problem isn't a blockage here, it's down in the lungs. So you have to use something that will do that. That's when we're going to get to the EpiPen part. So it increases the heart rate, dries the mouth, it blocks those things. You're cold with sweaty skin because the circulation is not going to the skin per se. It's being redirected to muscles and to your heart. The sweatiness comes from an effort because your body is going to be increasing in temperature to reduce the temperature. It's sort of a unique way, and we'll get to that as well. And your pupils are wide open so you can see. And we see it during vigorous physical activity, the dilation of the bronchioles to increase air, and because you need an energy supply is where glucose comes from. It's very interesting. So the whole idea of maintaining that level scientifically is really what aerobic exercise is about. Eventually, after about 30 minutes, your body starts to burn fat. We looked at that before when we looked at muscles. And you can maintain that for a long period of time. And that's why my wife is advising me in no uncertain terms where I better be going during this 5 weeks off. Moving your posterior, to use a different term, to the gym. In a loving way. Three main differences. Parasympathetic fibers, craniosacral. And the sacral part you will see is all about reproductive. This is when we begin to understand the nuances of reproductive physiology. They're controlled, again, and this is the ultimate display of, if you will, of the interactions between these two. More eloquently stated, as part of sexual excitation and climax. We will see. Sympathetic fibers are thoracolumbar, originate the thorax and lumbar region of the spinal cord. Again, parasympathetic, long, getting to the target, and then short after the target. Sympathetic, the opposite. And it's not a big deal. Parasympathetic they basically synapse where the ganglia are close or at the targets or within them, and the sympathetic by the spinal cord. You'll see it. Easier to show here. Really good diagram to look at. Here's the paras. Okay. 3, 7, 9, and 10. 3 to the eye, 7 and 9 to the salivary glands. 10, the only one that leaves the head and neck area. Heart, lungs, gastrointestinal, pancreas, these are all part of the gastrointestinal, bladder, genitalia. Okay? All of the above. Not everything has dual innervation. That's when I talked about all, and I didn't like that word because people do PowerPoints don't necessarily know what they're talking about. Notice in the sympathetic, Okay, here the ganglia are close to the end organ. Here you can see they're relatively close to the spinal cord, much closer than the diagram would make you think. But look at the areas that they don't. The skin. Your body's generating so much heat. Skin, the part that goes to the skin, is much more about perspiration. That's a cooling mechanism. We don't have that in the parasympathetic. Lungs, heart, stomach, pancreas, liver, adrenal gland. This is specifically the adrenal medulla, that interior portion that releases epinephrine and norepinephrine, that, if anything, prolong the effects. None here. And lastly, and certainly most importantly, and not listed here, typical of the diagrams, is blood vessels and the kidney. Okay? When you get to kidney, you're going to learn it's all about blood pressure. Your blood pressure is all about the sympathetic nervous system. And because of that, that's what the kidney relies on. The kidney is a high pressure filter. If it does not have sufficient blood pressure, the kidney shuts down. The kidney's like that. If anything goes wrong with the kidney, it has one response: it shuts down. And when the kidney shuts down because of extremely low blood pressure, we have a word for that: shock. Shock is low blood pressure, and inevitably the kidney shuts down because of that. Unfortunately, that happened to me 19 years ago. It gave me a short 3-day stay, thankfully, in ICU. I think I told you that, didn't I? Maybe not. That was 2006. I was 55 years old, and they called my 87-year-old mom, who was still very cogent at that time, and told them I was close. Something a mom does not want to hear. But yet I'm here to annoy you and regale you with these interesting anecdotes. You don't have to thank me. Happy to be here. So what it does not innervate, blood vessels, and so to the kidney. So that's the parasympathetic. The sympathetic goes to the skin. The sympathetic goes to the adrenal gland, and the sympathetic goes to blood vessels. When you learn about blood pressure, it's all about the diameter of those blood vessels. And so too, because of that, that either makes the kidney work or not. Moving on. Yeah, I'm not reading. Parasympathetic craniosacral. As we said, long pre, short post, no big deal. Terminal ganglia, don't care. If you listen to that recording review, and I'll amplify it because I'll have the exam finalized in front of me probably on Monday in the review sessions. I'll let you know specifically. There aren't a whole lot of. The questions are more about in fight or flight, what happens. Okay, what do your eyes do? They dilate. If you're out of fight, if it's a parasympathetic is dominating, what does your heart do? It relaxes. Okay, that's it. So here it's showing you this again, the same illustration in the brain stem. Oculomotor nerves, we talked about this, constrict, lenses bulge for focusing, and that's all because of the muscles, and you'll get to that when you look at the anatomy of the eye and the physiology of the eye, which we did not do. You'll probably dissect the eye. It's a really good dissection in AP2, and I'd be pretty confident Dr. Robbins would be doing that. Okay? And that's with something called the ciliary ganglia. You don't have to know that. Facial nerves, again, glands, salivary glands, submandibular, sublingual. Glossopharyngeal, don't have to worry about any of these synapses. Pterygopalatine ganglia. Don't have to thank me, it's all part of the service. Okay, again, that's salivary gland. And vagus, 90%. All those fibers, all, big word, thoracic and abdominal viscera. Preganglionic fibers rise from medulla, synapse, blah, blah, blah. Go to the heart. And understand this is really important when you get to heart. I talked about it when we talked about the cell cycle. Our body tends to go at a rapid rate. When we're in good health, we basically govern things. keep the cell cycle intact. If not, we have cancer. Our heart rate would normally be over 100. That would be very bad at rest. So when your parasympathetic system is working properly and you are in good health, it holds back the heart to roughly between 60 and 80, unless you're, an athlete in training, or young healthy people like you would probably have a relative having a heart rate 50 to 60 would not be out of usual. Okay, that slows the heart rate. It's going to be important down the road. You're going to see when we start talking about neurotransmitter. Does the lungs? Does all those gastrointestinal good guys? S2 and S4, I'll correct that, but I was not going to ask about that. Pelvic organs and part of the large intestine, okay? And these are involved in the bladder, the ureters, and reproductive organs. They play, as you will see down the road, they play an important role in both men and women in the process of excitation in involving the sex act, okay? So in sexual stimulation, it starts with the parasympathetic nervous system. It ends at climax or orgasm or ejaculation, which is mediated by the sympathetic. They work in concert. That's why it surprises people why someone who is paralyzed, that's different. That's a different nervous system. Why Stephen Hawking was able to have children, although he had ALS. That affected his motor nerves, not his. And there's a famous line in that wonderful movie, okay, that the name of the movie I forget, but Eddie Redmayne won an Academy Award. When they looked at him about you're having another child, he goes, different nervous system. Sort of a cheeky, very nice British cheeky response. So here you can see all the things. You can blow up the illustration and take a look at it just as easily as I can sit there and describe. Sympathetic, more complex, innervates more organs. These are innervated only by the sympathetic. Sweat glands and erector pylon. When your hair stands on them, when you get goosebumps or whatever you call them, get excited. That's your sympathetic nervous system. And what that does, it innervates those and the sweat glands. The smooth muscles, and that's a big word, all blood vessels. And because of that, that means the kidney. Okay? So thoracolumbar division, I'm sure it's not on there. That's when I looked at the spinal cord, those little lateral horns, that's really where those nerves are coming from. If you go back and look at the spinal cord anatomy, the same illustration that's there, and they have a whole lot of these ganglia. These names no one wants to remember. I don't want to remember. I don't want to remember any of that. This is where they're located. You can see right outside along the vertebrae, not like the diagram. Years ago, when somebody had bad circulation, was going to use the leg, we'd yank those out because it controls blood vessels and it would dilate them. It didn't work. Okay, but that was the treatment before we had grafting and we could bypass grafting, things like that. When I was in the hospital, that was still being done. When I was a resident, that's almost 50 years ago. So the technology has changed and the science has understanding. I mean, I scrubbed in on one of those sympathetic, yanking out that whole chain of nerves. To me, it's something that always was like, why in heaven's name are we doing that? Okay. You don't have to know any of these ganglia or collateral ganglia, who cares? Okay, or Rami, we don't have to do that. Again, with my advanced class, when we start to look at that, Rami are just wing like projections. They're tiny branches, don't have to know that. Okay, you don't have to know any of that stuff. I mean, I'm trying to keep it very, I said this before and I will say it again. If you want to understand this chapter, just understand what fight or flight is, because it's almost entirely pure sympathetic and the opposite is parasympathetic, and you'll be well ahead of most of the questions. So KISS, keep it simple, stupid. And then, who cares? Who cares? Who cares? And Gresser and later Splanchnik. Splanchnik is in here. All that stuff. So, I mean, you can go crazy with this. This is the interesting one. Going directly to the adrenal medulla. Most of us think that's the ganglia. It's really interesting. It's sort of misplaced. It should be near the spinal cord, but for some unknown reason, it's managed to work its way on top of the kidney. And it stimulates, and they're called medullary cells because they're in the medulla, the middle or interior area, both epinephrine and norepinephrine, which are very, very similar, chemically speaking. In the old days, we called them noradrenaline and adrenaline. So that's misserved. That should be also called noradrenaline and adrenaline, not norepinephrine. Okay, arise from the same tissue. So the adrenal medulla, and this is true. Even though you look at it in endocrine, this is a much better way to look at it. It's a ganglion that, for some reason, isn't where it's supposed to be. Down deep inside here, and because of that, the blood vessels, they go directly into this blood vessel here. So it's kind of an oddball, if you will. Well, what governs all of this are these, we have sensory neurons all over that inform us about different changes. In the hypothalamus, where the blood-brain barrier is weakest, most of these sensors are that are able to detect chemical changes in different organs, like the digestive tract. When they're being used, they have stretch receptors, temperature receptors, different things you put into your gut. For instance, when you vomit, okay, normally it's because something is an irritant. It's protective reflex. You throw up because you could be endangering yourself if you swallow that. Your body learns that and move like that. See, that's why there's so many different things. Some people throw up for a variety of reasons, but that's a classic one where your body's protecting itself. So there's lots of nerve endings that are there. They're all over the place. So they're continually monitoring conditions or organs serviced by different autonomic nervous system nerves. Okay, and without going through that, there's reflex arcs. They go into this in detail, and we're not going to consider it. The gastrointestinal tract, I will leave that for you for AP2. Suffice it to say, your GI tract works without any innervation. It doesn't require, it has its own nerves embedded. It's based on stretch and chemical. When you put food in, it stretches, depending on the chemical nature of the food that's going into the particular part of the system, it responds to it. Okay. Now, I have had half of my stomach removed not once, but twice. And they remove the nerve, that part of the vagus nerve is called the vagotomy. They section or take out a segment so the nerve doesn't go back together twice. I can't eat as much, but I certainly can eat. Don't say it. I know. That's why my wife wants me to get into the gym. She uses an F word that I will not repeat. It ends in a T. Sure. Rhymes with cat. Terribly mean. So, with a little bit of time we have left, I just want to bring these. This is really the subject of the rest of this chapter, are the neurotransmitters, acetylcholine and norepinephrine, and the names we give them. If acetylcholine is released, we refer to that as a cholinergic fiber. Okay, all autonomic nervous system preganglionics, all parasympathetic postganglionics. Norepinephrine, because of the old term adrenaline, we call them, if it releases norepinephrine, we call them adrenergic. These are both really important. Almost all sympathetic postganglionic axons, except those at the sweat glands, release acetylcholine. You must remember that exception. Other than sweat glands, the end product of the sympathetic nervous system, the postganglionic nerves, is norepinephrine, with the exception of sweat glands that release acetylcholine. The effects of the neurotransmitter depends on whether it binds to what we call a cholinergic receptor, response to acetylcholine, or an adrenergic receptor. We're going to look at those in detail because that's sort of the tie-in to pharmacology. That's on Friday. Same illustration you saw before. And then we'll get into this with these different types of receptors. I don't want to start it now with nicotinics and muscarinics, but you're just going to love it. Now you're going to understand a little bit about what tobacco is. Let me start and the effects of nicotine. Okay? So I'll leave you with that little teaser, so to speak, as they say in the entertainment industry, and say adios, goodbye.